The hymen. It's a small piece of tissue that's been shrouded in mystery and misconception for far too long. This thin membrane, located at the opening of the vagina, has been culturally significant for centuries, often wrongly seen as a marker of virginity. However, the truth about the hymen is far more nuanced than these outdated beliefs suggest. Understanding the reality of the hymen, its natural variations, and its lack of correlation with virginity is crucial for dispelling harmful myths and promoting accurate sexual health education. This essay will delve into the science and social impact of hymen myths, providing clear and accessible information to empower individuals with knowledge and challenge harmful societal norms. The hymen is a thin, flexible membrane that partially covers the vaginal opening. It is typically present from birth and can vary greatly in shape, size, and thickness from person to person. Some hymens are thin and stretchy, while others are thicker and less flexible. Some may have a single opening, while others may have multiple openings or a crescent shape. These variations are entirely normal and do not indicate anything about a person's sexual history. It's important to remember that the hymen is not a barrier that breaks during sexual intercourse. In fact, many people with hymens do not experience any tearing or bleeding during their first sexual experience. The most pervasive myth surrounding the hymen is its association with virginity. This belief falsely equates an intact hymen with virginity and a torn hymen with sexual experience. However, this is simply not true. As we've learned, hymens come in various shapes and sizes, and many factors can cause changes to the hymen besides sexual intercourse. The idea that the hymen breaks during sex is a harmful misconception that perpetuates shame and misinformation. This myth is not based on scientific evidence and has been debunked by medical professionals worldwide. Numerous activities and life events can cause changes to the hymen besides sexual intercourse. These include tampon use, physical activities like cycling, horseback riding, or gymnastics, medical examinations, and natural stretching during puberty. The hymen is designed to stretch and tear gradually over time, and these changes can happen naturally and without any sexual activity. It's crucial to understand that a person's sexual history cannot be determined by examining their hymen. Section 5. The social impact of hymen myths. The myths surrounding the hymen have far-reaching and damaging consequences for women and girls globally. In many cultures, an intact hymen is still considered a prerequisite for marriage, leading to harmful practices like virginity testing and hymenoplasty, which is the surgical reconstruction of the hymen. These practices are not only medically unnecessary, but also violate human rights and perpetuate the objectification of women's bodies. The pressure to conform to these societal expectations can lead to anxiety, shame, and fear among young people, particularly girls, about their bodies and sexuality. Section 6. Cultural practices and beliefs surrounding the hymen. Hymen myths are deeply ingrained in many cultures, often rooted in patriarchal beliefs that control women's sexuality and bodies. These beliefs vary across cultures but often share common themes of purity, honor, and family reputation being tied to a woman's virginity. In some cultures, virginity testing is performed by family members or medical professionals, often without consent and using unreliable methods. Such practices are a violation of human rights and can have severe psychological and physical consequences. It's important to challenge these harmful practices and beliefs by promoting accurate information and advocating for women's rights and bodily autonomy. Section 7. Challenging misinformation and promoting sexual health. Combating hymen myths requires a multifaceted approach that includes comprehensive sexual education, access to reliable information, and open conversations about sexuality. Schools, healthcare providers, and families all play a crucial role in providing accurate and age-appropriate information about sexual health, anatomy, and relationships. Challenging misinformation and promoting critical thinking skills can help individuals make informed decisions about their bodies and relationships. Section 8. Embracing body literacy and respect. Empowering individuals, particularly young people, with body literacy is essential for dismantling harmful myths and promoting self-esteem. Body literacy involves understanding how our bodies work, appreciating our individuality, and respecting the diversity of human experiences. Encouraging open communication about bodies and sexuality within families and communities can help to destigmatize these topics and create a more supportive and informed environment. Section 9. Conclusion. Moving beyond myths and embracing reality. The hymen is not a measure of virginity, and its presence or absence does not define a person's worth or character. It's time to move beyond outdated myths and embrace the reality of our bodies. By promoting accurate information, challenging harmful beliefs, and empowering individuals with knowledge, we can create a future where sexual health is understood and respected, and women and girls are free from the constraints of these harmful misconceptions.